Mr. President.
The senator from Missouri.
Mr. President, I'm pleased to have had a chance to listen for really the better part of almost an hour to my two neighbors, Senator Harkin and Senator Coburn, one from Oklahoma, one from Iowa, both of whom, as many of us do, apparently have totally different views of why we're here and what's going to happen based on what we do in the next few days and the days that follow after that. First of all, why are we here, Mr. President? This is the new spending year starts a week from yesterday. It starts next Tuesday. And has the Senate passed a single appropriations bill? No. Why are we doing this again? Why are we so committed in the last 5 or 6 years to management by crisis? I think in the last 6 and it may be 7 years now, the appropriations process has not worked one time. Wasn't too many years before that when we passed all the appropriations bills for the year that ended September the 30th and began October the 1st in July, all of them individually. And that's how the government worked and was supposed to work. Here we are, a week away. Why are we here? Why does everything have to ride from crisis to crisis? You know, that's why people are frustrated, people are upset. Senator Harkin, my good friend, and I, we're both frustrated and upset. We'd like to see this process work. The Appropriations Committee would like to see the process work. Why do we go from hanging from one edge of the cliff, standing on one edge of the cliff, to the next time people pay any attention, we're on another edge of another cliff again? We need to work to make this process work. You know, there's been, as Senator Coburn pointed out, been some significant disagreement on where the current debate could take us. One side believes that one side of that debate believes that at some point the President of the United States would sign a bill that eliminated the health care plan that he calls now Obamacare, and so I'm going to call it that too, as he has, and Senator Harkin has alternated using that term. I don't believe the president would sign that bill, but I do believe he's president. I do believe he has to sign a bill for the bill to happen, and so we have to, at some point, decide what can we do to make this process understood in a better way by the American people. It's referred to that with health care, this is a starter home. I don't know exactly where this goes, but I do know that the majority leader in the last few days said, well, where this really heads is a single payer system. I'm not for that. Nobody, as far as I know, nobody on my side of the aisle and many people on the other side of the aisle aren't for that, but that's where the Senate majority leader said this goes. And I don't want to go there. So what can we do to make the health care system work better? And I want to talk about that a little later too, because there have been plenty of ideas of what could make this work better. Apparently, when it comes to not moving forward with the Affordable Health Care Act, the administration believes it can decide what not to move forward by, but the Congress can't. It can decide what to just essentially repeal. Part of this act was called the Class Act, the long-term health care provisions that about 1.5 years or 2 years ago, the Secretary of HHS just said what I said in the committee when this bill came up, when I was in the House committee, that the Commerce Committee this dealt with. This long-term plan won't work. Oh no, it'll work and it'll provide lots of money. Well, Secretary Sebelius, even though it's the law, said in about 1.5 years ago, this really won't work, so we're not even going to try to do it. Now, interestingly, the president also said in normal circumstances, I'd go to the Congress and say, change the law, but these aren't normal circumstances. I don't believe there's a presidential prerogative to decide whether in normal circumstances or not. If the law needs to be changed, let's change the law. If parts of it need to be repealed, let's repeal it. If parts of it need to be postponed, let's postpone it. And here we are, not only 6 days from the beginning of a new spending year, but we're also 6 days from what will be a critically important moment for a lot of families, a lot of individuals, employers, people who are going to be looking at this exchange, and they don't seem to be ready. been hoped that there'd be available information out there so that for weeks we could have sort of what's called the dry run, where people could see if this works or not, where they can compare plans or not. That's just not there, and we know it's not there. Now, in Missouri, where I live, people have been concerned from the very first about what they saw as a flawed law. In fact, our state was the first state in the country to actually vote on whether we wanted to be part of this or not. And overwhelmingly, Missouri voters said no when it was more popular in any polling than it is right now. You know, people have looked at this and they don't want to go there. Missourians in August 2010 had a vote on the ballot, and 71% said that we shouldn't participate. 71%. And that was, again, when the law was more popular than it is now. This is the first time that people had had a chance to vote on this. In November of 2012, Missouri voters voted again. This time, the direction to the legislature was, and to all state agencies and the governor, don't establish a state exchange unless the legislature agrees. There was some disagreement as to whether the governor could do that on his own. Missouri voters said, we don't want you to do that on your own. And so far in our state, as in a majority of the states, it hasn't happened. The implementation will is not there because people don't believe this plan will work. The elements of this that improve what happens in a competitive marketplace could still be there in other changes we could make. This is incredibly unpopular around the country. People are frustrated by it. People are looking for ways to end moving into the Affordable Health Care Act that just simply won't work. Senator Coburn explained earlier why they wouldn't work. Charles Krauthammer, one of the leading conservative commentators in the country today, said about one of the plans this week, it won't work. The president's health care plan is falling under its own weight. When something like that's happening in politics, you don't rush in to stop it from happening. If you don't think that the law should be implemented anyway, let people see that this won't work, and we're seeing that. I'm for defunding the plan. I'm for starting over again. I believe most Americans would like to see us start over again and take the best health care system in the world and make it work better. Anybody who was defending our system as perfect got into a trap they shouldn't have got into because it wasn't perfect. Largely an accident of a couple of decisions made in the 40s where health care and health insurance became way too much dependent on where people worked, where people didn't have the ownership they needed in health care, and where we didn't have the competition that we needed to buy across state lines, to shop for a better product, to do all those things. But this is a plan where, again, the law is the law unless it applies to the administration, apparently. The Congressional Research Service, no partisan organization, the Congressional Research Service recently found that the administration has missed 41 of 82 deadlines. Now, if you're a batter in professional baseball, that's a pretty good average, 500. It's not very good if you're trying to figure out how to implement the law. Missed 41 of 82 deadlines. The employer mandate requirement, the White House has said is unworkable now and announced its delay. How in the world we could defend saying that employers don't have to meet their requirement, but individuals have to pay a penalty if they don't have insurance? How can any of my friends defend that? We ought to, at the very least, postpone the individual mandate for as long as we postpone the employer mandate. If individuals are paying a penalty and employers who the law says are supposed to offer insurance are paying a penalty, aren't offering insurance and aren't paying a penalty, there's something wrong with a government who decides that that's the appropriate way to do this. Despite the employer mandate announcement, we still see businesses beginning to react because they know this is eventually, or they believe this is eventually likely to start. businesses big and small trying to look at, well, if somebody doesn't have to have insurance if they don't work more than 30 hours, maybe we should have more employees that work less than 30 hours because our competitor might decide that. Are companies that have always provided insurance and assistance for families and spouses deciding, the law now doesn't say we have to do that, so we're just not going to do that any longer? The law initially anticipated 3 million people that currently had insurance would lose that insurance. It's going to be a lot higher than that. And the same people that were saying 3 million are today somewhere between 8 and 15 million. And Mr. President, that number is going to go up. All you've got to do is calculate what's just been announced in the last few days to know that's going to go up. This is a plan where people who were for it, and I was not for it, I have not been for it, I just simply don't believe it will work, Mr. President. People who were for it overpromised, and now they're under-delivering. That famous statement made over and over again, if you like your health care plan, you can keep it. Well, nobody believes that anymore, and in fact, ask the employees at General Electric or IBM or UPS or Walgreens or Home Depot or thousands of smaller businesses than those. What about keeping the health care plan you liked the day that commitment was made? Those plans aren't there anymore. Those plans aren't there anymore. It was one of the main selling points of this plan. If you like your health care, you can keep it. Just turned out not to be true at all. Not only has this not made health care more affordable, but family premiums have gone up by more than $2,500 since this became the law, even though it was the law and we're moving toward it, not implemented it. Nearly 3 in 4 small businesses say they plan to cut hours or let employees go because of the president's health care plan. People who have fewer employees are doing everything they can not to have more than 50 employees, rather, are doing everything they can not to have more than 50 employees, because that's one of the criteria where you're really penalized under this law. Meanwhile, in April of 2013, the administration said that it would delay a provision that allowed employees to pick their own plans in states that have the federal exchange. States like ours, just not going to happen. Another delay. In July of 13, the administration delayed enforcement of the employer mandate for a year. In July, the administration announced it would significantly scale back the requirements for new state-based insurance marketplaces to verify income. When you scale back the requirements to verify income, you're also scaling back the burden that people have to provide information in order to get assistance. I assume that means more people will get taxpayer assistance, but it also means that the cost of that assistance is going to be higher, just for many reasons. That's one of them. Another one is that people are going to be on the exchange that everybody anticipated would still be getting workplace-based health care. In August of 2013, the Department of HHS, the Health and Human Services, delayed the signing agreements with insurance companies that were supposed to have specific amounts available in August. I wrote a letter at the time that said, it's really important that you meet this deadline because people need to begin to think about the decision you want them to make beginning October 1. The Department of Labor delayed a limit on out-of-pocket spending for beneficiaries from 2014 to 15. Again, apparently, if you want to delay the law, if you want to decide that you're not going to enforce the law, that's okay. But for those of us who say, let's have a permanent delay, let's not fund this and now go back and start with a process where the House passes a bill, the Senate passes a bill, the two bodies come together and talk about the differences. That never happened with this law. My friend from Iowa said, well, it's a starter home, but there's no remodeling process to start up for the starter home, and we're seeing what happens there. Unfortunately, too many examples of this. Americans deserve common sense healthcare solutions. where doctors and patients are in charge, not government bureaucrats, not people at the IRS. When you've got a health care bill that adds thousands of IRS new workers and doesn't add a single new doctor or nurse, you probably missed the boat in what you're trying to do with health care. And for better ideas, there are lots of better ideas out there. More individual ownership, fair tax treatment. The tax treatment that we've had for decades now, where you don't pay income tax on a benefit you get at work, but if you get if you get insurance on your own, you do that with dollars you have paid taxes on. Now, one way or another, make that equal. Either say nobody gets a tax benefit for the money that's used to buy insurance, or everybody gets the tax benefit. Let people shop across state lines. Let people find what they need that meets the needs of their family. You're going to have more single young adults without insurance on this. And why are you going to have more? Not because of the provision that allows people to stay on their family. That actually added people to the insurance rolls, but because of the provision that says that the most expensive people you insure can't be charged more than 3 times the least expensive people you insure. Young, healthy people are going to look at insurance rates higher than rates that they have ever seen on the individual market again before, and it'll make a difference. There's plenty that can be done here. My colleagues on the other side face an important decision this week. They can stand with what is now the overwhelming majority of Americans who have rejected the direction we're headed in and say, let's defund this. Let's start over again. The one thing we've got in front of us that would allow us to start over is the House bill that we just voted to move forward on that would defund Obamacare and let us start over again. Or my friends on the other side can decide that the president and Senator Reid are right, that Senator Reid's idea of this leads us to a single-payer system is where we want to go, that the president's idea that he can change this law however he wants to and the Congress is not involved is right. I would just strongly urge all of my colleagues to join me in voting against any attempts by the majority leader to restore funding for this flawed law and to work with all of us working together as we work to replace it. And with that, I'll note the absence of a quorum.